All right. Hi, everyone. My name is Kaylee Lowe, and I'm a future psychiatric mental health nurse practitioner. And this is my presentation on the role of a nurse practitioner. All right. Oh, okay. So what is a nurse practitioner? A nurse practitioner is an evidence practice registered nurse who provides high quality evidence based care by combining nursing and medical expertise. NPs can assess, diagnose, treat, prescribe medications, educate patients, counsel, and manage patient care across a variety of populations, often with full practice authority depending on the state they are in. Full practice authority means that they can do all this without supervision of a physician. Massachusetts is one of them. NPs care for individuals in primary and acute care settings, and they also support people with long term chronic health conditions. All right. So, what is a nurse practitioner versus a physician? So, they are both advanced providers with master's degree, but they differ in their training, philosophy, and practice models. NPs must first become registered nurses, RNs, by gaining clinical experience and then completing either a master's of science in nursing or a doctor of nursing practice. PAs enter directly into a master's program and physician assistant studies without first becoming nurses. NPs may practice independently in some states, collaborate with physicians in others, and work under physician supervision depending on state regulations. PAs typically work under supervision, a supervising physician, though in some settings they can function more independently. NPs take their boards through nursing state board exams, and NPs take theirs through the state medical board exams. Nurse practitioners choose a specialty, such as family practice, psych, pediatrics, or geriatrics, before entering their graduate program and must pass board certification exams in that specialty area. They can later change or add specialties throughout additional certification. PAs are trained as generalists and rotate throughout various specialties during their education, which allows them to work in different areas of medicine without needing new credentialing every time. NPs are trained in the nursing model, which emphasizes holistic and patient-centered care, where PAs much they follow the medical model, which is a disease-centered model. Okay, so then NP versus physician. So NPs, nurse practitioners, are advanced practice nurses who undergo significant but shorter training compared to medical doctors. While both NPs and physicians can evaluate patient illnesses, order tests, prescribe treatments, and work in primary and acute care settings, their roles and preparation differ. So for NPs, they complete a BSN, which is a Bachelor of Science in Nursing, pass the NCLEX, gain clinical experience, and then either get their master's or their doctorate. So it typically takes around 6 years. Physicians, they have to complete a bachelor's, which is followed by 4 years of medical school and then at least 3 years of residency. So it's a longer training path. In 27 states, two territories, and Washington, D.C., NPs have full authority, allowing them to provide care independently without supervision of a physician, whereas a physician has autonomy in every state after their training and residency hours are met. The NP, they follow the nursing model, which is patient-centered care, holistic, and preventative care, where doctors have a medical model, which is disease-focused, diagnostic, and treatment-based. NPs provide excellent, accessible care, especially in primary care and mental health settings with less training time, where doctors handle complex medical cases, can perform surgeries, and receive longer, more intensive training. So, why did I choose the NP path? So, sometimes people ask, like, why didn't you just become a doctor? And so, for me, the answer is pretty simple. I have my deep values of the nursing profession. I was drawn to the NP role because of the focus on the advocacy, the empathy, and empowering patients to take control of their own health. I was also just ready for the next step. After gaining the experience as a nurse, I just felt like I was ready to take on more of an advanced role in patient care and decision making. I also was desiring for more clinical knowledge. So I wanted to expand my medical knowledge, my diagnostic skills, and treatment planning abilities. I just always found myself wanting to know more or why or how. Like, how does that medication actually work in the body? Or how do you know how to switch to a different medication? So many of these little things were becoming fascinating to me. besides bedside felt like it was just becoming like a repetitive pattern. I tried other floors. Like I worked on the medical floor, a float pool, I did travel nursing, and then I finally switched to psych at the end. And that's where I just decided, like, you know what, like I want to dedicate my knowledge here. I love psych and I want to know more. And I want to be on the provider side because sometimes I feel like nursing, you're just like the middleman. And I want to be like, just in a higher position. I also just see it as a career advancement and I want some professional growth. Becoming a nurse practitioner opens doors to leadership opportunities, increased responsibility, and a stronger voice in healthcare. I also think it's pretty cool that you can have more autonomy in practice. I think being able to work independently seems like a pretty cool thing in the future and also work collaborative if I want to. And then I can just make my own clinical decisions on my own. And then lastly, I also want to become an MP for work flexibility. The MP role offers options beyond traditional bedside. You can work from home through telehealth. Once I have kids, I think it would be nice to be able to log on and have a little work from home job. You can also have flexible scheduling. Some places still do 312s, others do Monday through Friday. Then you have holidays and weekends off, where other places do 410. So I just think, you can get more of a work life balance and prevent burnout. But yeah, so that's the reason why. And then these are my references. Yeah, sorry if I went a little fast. All right, thank you for listening.